Hello, everyone. Thank you for your patience while we let a few more folks show up. Thank you so much for being here with us this afternoon. I'm so excited to eventually turn it over to Dr. Jetelina, but I do have a few things that I'd like to say first. And thank you to everyone also that is joining on Zoom. We do have people monitoring the chat, so if there's any technical issues for our virtual attendees, just pop it in there and we'll try to fix it in real time. For those of you that I do not have the pleasure of knowing, my name is Jessica Buck-Atkinson, and I am the Associate Director of the Firearm Injury Prevention Initiative here at the University of Colorado Anschutz campus. I want to start today by really thanking our partners in all efforts, but particularly this effort to bring Dr. Jetelina to campus today. The Colorado Office of Gun Violence Prevention, who I know is here in the audience today. They're based at the Colorado Department of Public Health and the Environment. And then also our friends at the Injury and Violence Prevention Center, which lives in the Colorado School of Public Health. We collectively first started talking about bringing Dr. Jetelina to campus about a year ago. We felt that her expertise and her wisdom seemed important and relevant then. And much to our dismay, the importance and relevancy within this current context is somewhat profound. I think it goes without saying that now more than ever, amidst the dwindling public trust in institutions like public health, medicine, and academic research, alongside the organized threats that are currently targeted at the foundation of research in medicine as well. We as public health and medical professionals really need to push ourselves to evolve our thinking on how to best reach communities and partners across all topic areas. We had the opportunity this morning to do a workshop with Dr. Jetelina, and I am so excited for you all to hear her speak today because there are so many ideas that I have rattling in my head that I think will stay there for a long time after having some time with her this afternoon. So before we welcome her up to the stage to talk today, it's my pleasure to introduce Dr. Ned Kalange, who serves both as the Chief Medical Officer at the Colorado Department of Public Health and Environment, as well as the Colorado School of Public Health's Associate Dean, for Public Health Practice, to say a few words.
It's a real honor and privilege to have the opportunity to introduce Dr. Jetelina. Dr. Katelyn Jetelina is an epidemiologist and a scientific communicator. She's a co-founder of Health Trust Initiative. She's an adjunct professor at the Yale School of Public Health and a former scientific advisor to the Centers for Disease Control and Prevention and to the White House. In addition, she's the founder and CEO of Your Local Epidemiologist, a public health enterprise that translates ever-evolving science to the public with a newsletter that's reached over 500 million views in 133 countries. She serves as a scientific advisor for Resolve to Save Lives, and this is a group that works to prevent 100 million cardiovascular disease deaths and to reduce the impact or risk of epidemics on the world stage. She's also a member of the Medical Advisory Council for Make-A-Wish America. She received her PhD in epidemiology at the University of Texas Health Science Center at Houston. She is a strong advocate for the importance of communication and communication skills in public health. She's received numerous national awards and was recently named a Time 100 Most Influential Persons in Health. So we're thrilled that you're here to talk about this very important issue, and I assure you we will hang on every word. Dr. Jetelina.
Good afternoon, everyone, in person and online. I always say one silver lining of a pandemic is we don't have to explain what an epidemiologist is anymore, that we're not skin doctors, but we find patterns, right? And I've had a incredibly squiggly line career over the past 10 years, I would say, but I've really had one central theme that has gone across everything from me being a faculty member to working in government to having my own company, that we need better public health communication and engagement. And we need to basically make the invisible visible, which is really, really challenging to do, especially in the current environment. But we have to do it. If we don't, we risk funding, we risk losing leadership support, and and we risk losing public trust. And so I wanted to kind of bring a lot of the lessons I've learned in sometimes a really hard way to you guys to see how we can start integrating change in everything that we do, and start moving towards something different and a different system that works better for communities. Okay. So I wanted to give a little background of why I'm here and who I am, because I was introduced by a violence prevention group, which is a little confusing to some people, that then I start talking about COVID and then I start talking about nutrition. But I got my PhD in violence epidemiology. I had a faculty position at the University of Texas, was going up for tenure. And then March 2020 hit. And I don't think I have to tell you guys what happened this month, but it was an all hands on deck response. And so every epidemiologist, whether you focused on coronaviruses or not, was joined in this fight towards this against this virus. And so I helped with the Texas response, particularly Houston, and then moved to White House as well as CDC. What you may not have known about March of 2020, though, is that when all of us epidemiologists respond, I always put respond in quotation marks because it was more of a scramble. We were scrambling to have data, to actually know what the heck was going on a national stage. We were scrambling for our tools, right? Tests, PPE. We are scrambling to understand what policies would work. We were basically throwing spaghetti at a wall to see what stuck at that moment. But most importantly to me, we were really scrambling to communicate, and not scientist to scientist, right? We're really good at speaking to other scientists, right? Through peer-reviewed articles, through conferences, through just peer interaction. What we're really terrible at is speaking in plain language to the communities we serve. And this is where I started to fill a gap. My dean actually came to me. She knew I loved teaching to students, and she was like, "What? Maybe Katelyn can be good at this." She asked me to write an email every day to faculty, staff, and students on what the heck was going on. This was one of my first emails, really ugly Excel graphs, right? 2 sentences. I mean, it makes me laugh, like looking back at these emails, like 2 sentences. I called them your daily data-driven update on what was going on. And I signed them, love your local epidemiologist, because that's who I was to them. And then a few days later, one of my students came to me asking if I could start sharing on social media so she didn't have to keep copying and pasting for her family and friends. And so I did. You know, I created a Facebook page, made this graphic on Canva, I think at the time. Are we good? Oh, okay. Sorry. No, you're good. We have technical difficulties. I can pause.
Okay.
I will pause.
I will do it really fast. Sorry, folks.
Oh yeah, there you go. Is it? Yeah, I don't know which one. See my notes.
Okay, great. Sorry about that.
No, you're good. Are we good? Okay, awesome. So I started a Facebook page. I created this graphic on Canva, not a graphic designer, but with the purpose of trying to close the loop to translate public health science for everyday use. And I told the group this morning that I distinctly remember telling my husband, I'm only going to do this for 6 weeks max, because then surely someone's going to pick up the baton. And that didn't happen. It moved then from Facebook as the primary outreach after I was hacked by anti-vaxxers in 2021, and made it back to a newsletter, back to its roots. And now it has, I just pulled the stats. I think it's reached more than 500 million people in 132 countries. And we are still going strong. One of the biggest questions I had after the pandemic was, does someone want to hear from an epidemiologist ever again? And I'm really proud that we have been able to pivot the public and understanding that public health touches on all aspects of our life, not just during an emergency and not just with infectious diseases. And so I have written about gun violence. I have written about nutrition. Tomorrow, there's a post coming out about seed oils. I mean, I'm just trying to be as responsive as possible to help equip people to make evidence-based decisions. I will say none of this was planned. It was not intentional. I stumbled into scientific communication. I've never had 1 hour of one course on how to communicate well. But I did teach, but this was different, right? Going public facing, going 2,000 miles per hour. I still feel like going 2,000 miles per hour. It's been rewarding, exhilarating. It's been very scary. And I often feel like I am in the middle of the forest with a machete trying to find my way, because this isn't what public health does, right? This isn't how we get tenure. It isn't how we get Nobel Peace Prizes. And it certainly is not how I gain respect from my peers. It's just not a priority. It's also not funded. And so, but I do think all of this is the reason why public health has lost trust. That it's one of the core reasons we're finding ourselves where we are right now today. And ultimately, it's invisible, and we need to do everything we can to make it visible in every day of our work. So my biggest goal right now is to scream this from the rooftops and share what I have learned along the way. I will say public health being invisible is not just a failure of this time, right? We're actually very proud that we have a long history of when public health works, it's invisible. We even have now a PBS series called The Invisible Shield, right? Public health saved your life today and you didn't even know it. So this isn't a new problem. Historically, we've seen some of the most impactful public health efforts being invisible until they failed or were taken away, right? 1800s, clean water and sanitation. We really don't even think about this unless there's like a cholera outbreak, or I guess now we're thinking about it with fluoride getting taken away. 1900s or mid 1900s vaccines, right? We only notice when there's a failure, and there is a failure with vaccine uptake right now. We're seeing whooping cough exponentially increasing, measles, huge measles outbreak in Texas right now. And public health has just become a victim of its own success. Mid 1900s, when was the last time you thought about seatbelts saving your life, right? These are all very invisible tools. Right now, a lot of data is invisible right now. Exchanges, modernization, no one can really feel or see this stuff, and that's the challenge. We have to make the invisible visible. And so I'm going to walk you through how I think about this, what lessons I've learned, and maybe they will help you try to help navigate through this forest with a machete with me. So the first thing I constantly ask myself is why? Why do we have to make ourselves visible right now? There's 5 reasons I have been really focused on. One is we have a rapidly changing information landscape. People get information in the 21st century very differently than they had in the past 10, 20, 30 years. We have social media. It's a huge part of how people get their healthcare related information online. 1 in 2 people get their health information on social media, which is a little terrifying, but it also means that we have to be there. We have to be where these conversations are happening. One huge challenge with social media right now is that platforms are optimized for engagement, which means that content that is sensationalism or emotionally charged gets the most attention. It goes viral. We see this study and study and study again. This was a study in 2018 that found misinformation or false news about health goes further, faster, deeper, and more broadly than the truth. They found that false news was retweeted more than the truth. It spread through more peer-to-peer interaction than the truth. False news spread 6 times faster than the truth on Twitter, and this was 2018, right? So this is before what's happening right now. Was retweeted by more unique users and was diffused more broadly than the truth. This all tells me that the truth is no longer dictated by authorities, but it is networked by peers. And we have to enter this landscape knowing this as well. Another factor contributing to this new information landscape is recognizing that there are just bad players out there, pushing this gap wider. And I'm going to give, this is a ton of examples of this. Wellness industry right now is worth more than $1 trillion. We also see this with anti-vax industry too. The anti-vax industry is worth up to $1.1 billion to big tech, because things go viral when these anti-vax messages go through. What I think a lot of people don't realize is that actually only 4 families control 70% of the anti-vax conversation on social media. One of them is now our Secretary of Health. And what he founded, the nonprofit called Children's Health Defense, was responsible for 1 in 4 misinformation tweets during the COVID pandemic. And they make a ton of money on this. The Washington Post found that 4 major nonprofits that rose to prominence during the COVID pandemic capitalized on spreading medical misinformation, and they gained more than $120 million in 2 years. So it makes them a lot of money too. So we have this rapidly changing environment. We also, and this, I shared this morning too, this is the most fascinating thing for me, is we have unleashed a curiosity-driven class in our environment, that people are really interested in not being told what to do, but want to explore, want to question for themselves, want to debate, want to understand for themselves as well. And I actually don't think this is a problem to fix. I really think it's more of a reality of this moment, of this landscape, and we have to embrace it if we want to succeed in public health as well. So this nature of expertise is gradually shifting right now. We see this rise of influence, and public health has just been way too late to the game for that. Also, I don't have to tell this group this, but budgets are also shrinking, leadership is changing, trust is declining. And so all of these reasons is why we have to make ourselves visible right now, and as soon as possible. Public health is getting dismantled. We have to really talk about why it's important and why it matters to the health of individuals and their families, not necessarily institutions. So the next question I always ask myself is, okay, great, then what can us, a bunch of nerds, really do about this, right? How do we make sure our truth, our research, our practice, our sweat, blood, and tears reaches the people that need it most? And what I have found over the past 10 years through my research as well as my work is that we in public health and data scientists and healthcare practitioners love to focus on what's sexy to us, right? Innovation, collection tools, the newest assays, gene discovery, AI. And don't get me wrong, all of these are really important, but none of it matters if the end user does not trust or understand or know what to do with that information that you're providing them. What I have found over the past 5-10 years is that we are desperately missing this last mile in the scientific discovery journey, and that's dissemination, that's translation, that is engagement. In other words, our job is not done after analyzing data. Our work, our science cannot speak for itself. We must speak for it. So the second thing I'm always asking myself is understanding the why is after the who, like who needs to hear this? Because what I have also found is that one message won't work for everyone. We have to ask ourselves who our audience, what they care about. And it's very different depending on what audience you're talking about. Then we have to tailor it to them. For example, your agency, your institutional leadership really cares about decision-making and hopefully data-driven decision-making. That's different than community partners that really care about actionable information, different than the general public, which is very different than policymakers. And policymakers think in dollars and security, particularly around public health. Not one message will not work for everyone. So before you even open your mouth, think about who you're talking to or who you want to reach and why, and then figure out what that word string is. One thing I keep seeing on LinkedIn in this moment over the past probably it's been 85 days, is a genuine frustration. And I totally agree with this frustration. The problem is this frustration is translating into things that are not resonating with who needs to hear it. For example, funding is cut to my institution, resulting in stopping major lab renovations. The big problem with this sentence is institution. 50% of the country loves the idea that it's hurting an institution because they do not feel like they've been represented by those institutions. And so even just advocating for your own work, thinking about it really differently. For example, connect it to why it matters for Americans. Fight for people's health, not science, not institutions, not our work, not our job. Say Americans will no longer get their blood results faster because testing labs are being cut around the nation, right? People understand why this matters to them next. Right now, what is really resonating with policymakers around public health is return on investment. And we have to get that message out there more. So for example, when we're talking about NIH research, link it to, hey, guess what? Every $1 invested into NIH research at the University of Alabama creates $2.40 return for the local economy. That really responds, at least on a state level right now. And so we really, again, think very strategically on how you're talking, who you're talking to, and what you're fighting for. Audience is everything. So part of this is also using words that resonate, right? Connecting your research to values and emotions. This comes down to the literal words we use and knowing your audience. I actually learned this a very hard way when I had breakfast with Senator Cassidy a few months ago. And I kept talking to him of like, pandemic preparedness, we're not prepared. And he stopped me in my tracks and was like, Katelyn, I don't care about pandemic preparedness. I care about biosecurity risk. It's the same exact thing. But what he was teaching me in that moment is that like I really needed to be thoughtful of who my audience was and use words that resonate with him. I think that there's many examples of this. Another example I've learned with my newsletter is you'll never find the word misinformation. It's a trigger word. I use the word rumor or falsehood. Also, messages around targeting the good of the community don't resonate with a lot of Americans right now. They want to know how it protects their family. And then also, it's not just the words, but the topics you talk about, right? People are really interested in data right now. They're really interested in innovation. So if you're talking to a policymaker, think about like make your work fit into data or innovation, like make that, because that is what is resonating right now. Then, so once you know the why, then you know who you're talking about, and then you need to think about the what, like beyond just these buzzwords, like what do we start talking about? If we go on social media, what topic do I start talking about? There's a lot of people right now really amped up about addressing rumors and falsehoods. And I kind of get this because there's a nemesis, right? Like that's wrong information. I can help correct that. I have the facts to do that. And I'll go in some strategies I've learned around combating mis and disinformation, but you'll hear where I don't think this is where we need to put our energy right now. Misinformation, I think we first have to realize isn't going to go away. That it's not like a plumbing problem we fix. It's a social condition like crime that we must constantly monitor and adjust to. The major challenge with scientific communication is the new shape of the truth right now. That truth, again, is no longer dictated by authorities, but it's networked by peers. And interestingly, guys, we don't actually know what works when combating misinformation. Like the research is being generated while we're trying to fly this plane as we go. There's been broadly two approaches. One is fact-based debunking. And this is basically, fact-based correcting a false claim or narrative. This is a game of whack-a-mole, as you can imagine. First, we're talking about mRNA vaccines not changing your DNA. Then we're talking about seed oils. And then we're talking, it's overwhelming. If you want to go down this route, the best solution is giving what we call a truth sandwich, which means start with the truth, indicate the lie, and return to the truth. So, for example, never drink bleach. You've heard that bleach can kill COVID, but it only works on surfaces, not inside your body. Drinking bleach can cause serious illness and death. So give them that truth sandwich. Don't start with the lie, start with the truth. What is far more appealing, at least to me, who's on the front line that doing a lot of this stuff, is not debunking, but it's called pre-bunking. And this basically explains tactics used to manipulate information. And this is, maybe I like this because it's more of a prevention tool rather than treatment. A lot of people have talked about pre-bunking as like a vaccine inoculation, right? Is you give it the training, and then once the misinformation is out there, the immune response or their response can be triggered, be like, oh, this is that fallacy I learned about from Katelyn. And so part of this is, yeah, true sandwich, but it really comes down to the fallacy that is used in that topic. And there's a ton of fallacies. I could maybe get you a list if you wanted to know them. But some of them are like false dichotomy, post hoc fallacy, correlation versus causation. I mean, I think everything that we're very familiar with, but all of them are rooted in basically oversimplifications. Another really interesting study that just came out, I don't know where, I don't think it's debunking, I don't think it's pre-bunking, but it's called bypassing. And so what this means is that you avoid head-on correction and instead highlight truthful, positively framed health messages. So for example, someone claims GMOs are harmful to consume. Instead of debunking that they're harmful to consume, say you bypass that inaccuracy by focusing on something positive about GMOs that like help the bee population, for example. One right now that's coming to the surface very quickly is legislation to stop use of mRNA vaccines because of the whole COVID thing. We don't need to correct the whole COVID thing with mRNA vaccines. One bypass is, hey, did you know that an mRNA vaccine just showed that it increased your life from prostate cancer for 10 years? Because we're creating an mRNA vaccine for prostate cancer. And so really bypass the whole topic and like provide a positive solution is another way. I will say there's a ton of resources going into mis and disinformation right now. We're talking about bills, we're talking about FDAs. Some schools are starting to integrate it into their learning, especially in Finland. FDA, well, previous FDA was really interesting in grappling this. And I would have told you maybe 2 years, great, like throw all of your resources in here, end of story, end of presentation. But what I have found, you guys, is it's always a game of whack-a-mole. And one way to stay ahead of it is to really think about mis and disinformation as the tip of an iceberg. That 80% of the reason people are making decisions are actually because of concerns, questions, and confusions they have. They can't find good information sources, so misinformation fills that information void. And so I have been really trying to push scientists and institutions and whoever wants to hear it, do not necessarily just focus on the top. We need to spend a lot of our time on the bottom, clearing up confusion, anticipating concerns, meeting people where they're at. Because if we want this iceberg to move, we need to really address what's below the surface first. Part of being proactive is, like I said, and part of addressing what's below the surface is anticipating concerns. One thing that drove me insane during the COVID pandemic was that we knew we had 9 months to develop a vaccine, and we did nothing to prepare or anticipate the questions from the public. And not about, I mean, mRNA changing your DNA, not about why was this so fast? How could it have been? I mean, really great questions we could have been very proactive about. And then we were surprised that, 40% of Americans really lined up at the first moment to get their COVID vaccine. People had questions, and we did not lean into this or participate or anticipate or prepare for that big rollout. And this isn't just during a pandemic, right? We have fall. Now we have a ton of vaccines. It's really hard for people to keep track of. Guidance is changing all the time. So I've been trying to do this proactively on different topics, like this one pager I put together for my audience about just what are these different options? When is the best timing for me? And try to put this out. I put this out in August of 2024, so before the vaccines were even available. Did that right now, November of 2024, right when the election was decided. I put together top 12 questions for childhood vaccinations that people may be afraid to ask about, because I anticipate, and I still anticipate, a lot of questions coming up about routine vaccinations. There's many ways we can anticipate concerns, but try to anticipate where people's minds are going before they get there. I think it's really important also, particularly during an emergency, to bring people along for the ride and tell them what we do know, what we don't know, and how we're finding answers. Will allow us to pivot when we need to pivot, when the science changes. This was a huge mistake during the COVID pandemic, right? Is that we were not bringing people along for the scientific discovery ride. So it was incredibly hard, and is still almost impossible to help people pivot when new information comes arise. The last thing I'll say about how, I think this is the last thing, is to really tell you guys that what you say matters. How you communicate correct information matters, especially to people who are not in your echo chambers, are going down conspiracy theories, or just don't trust you. For what we have been seeing is that there are headlines, there are cartoons that can be kind of funny, but this does not build trust and certainly doesn't reach people where they're at. We saw this during COVID too. Words like dumb or absurd or insane. The problem with this is that people will double down, rejecting your data, your message even more, because their views are linked to their identity and the tribes that we're a part of. We need to set new foundations of trust, and it doesn't start with this. We have to be very careful on what our words are. Okay. Last thing I always ask myself is how? How do we become visible? If we have the words, if we know what audience we're trying to target, what is the best way to do this? Well, first of all, no matter who you're talking about, it has to be in plain language. Just like we tell stories with words, people don't understand numbers or statistics if it's not translated into understandable terms in a timely manner. We in science are terrible at this. We get stuck in this world of numbers and unable to translate the incredible innovation and progress and work. The problem with this is no one will ever fund, appreciate, or act unless they actually understand what you're trying to communicate. Unnecessary complexity alienates the audience. Now, this does not mean dumbing down, but rather balancing nuance with understandability. One of the biggest lessons I learned during the pandemic was never underestimate the audience. Sure, they don't know what a bivalent vaccine was, they don't know what myocarditis is, but that doesn't mean that they don't deserve to know, and it certainly doesn't mean that they don't want to know. We just have to bring them along for that ride. So, speak in plain language. The other part of this how is we have to meet people where they're at. We are really good at making 50-page PDF file reports, and we're really good at scientific peer-reviewed articles that end up behind a paywall. But that is not where people are at. For example, a lot of us in public health aren't on the internet, not on social media talking about our research. Part of the problem is we don't have time. Part of the other problem is we don't have the skill set to start translating into plain language. And because of that, the internet or influencers go viral while our stuff just completely flops. I think this is a really good example about the risks of milk. One going viral saying it's as a secret to boost your immune system, another with words that I don't even understand as an epidemiologist. Part of this is also do not be a cold robot. This is what I talked a lot and try to institute change a lot over at CDC and the White House, is that people do not need more facts, more facts, more facts. They need narrators and they need storytellers. We do that by, like I said, avoiding jargon, but use storytelling. Frame your research in a way that connects to real world problems right now. I try this. It's really awkward. I'm not good at storytelling, but once you can try to figure out where people are coming from, tell a story about it and then go from there. Analogies help a lot. Analogies are helpful because they resonate with people, right? They can feel a tangible impact on this. One example is when I was talking about updating the COVID formula for updated vaccines, that we have a Word document and we're just updating one letter in that Word document. We're not changing it to an Excel document. We're not changing paragraphs. We are doing a little switch. And when people start understanding a more tangible item that they connect with, that really abstract sense goes away. So use analogies and of course have multiple versions, right? We have to think through how, if you develop a research story, how that looks different in a policy brief versus a Facebook post versus what you tell your public health colleagues. Part of not being a robot, and I think truly this is one reason my newsletter did so well during the pandemic, was I showed a human side. I hope my goal is for any time someone opens my newsletter, they can hear my voice, that it's not robotic or watered down or has gone through the clearance process so many fucking times that you don't even understand what it's saying anymore. And so that means people respond to actual people. They do not respond to brick walls like the CDC. They do not respond to institutions. They respond to a face and a warm body that cares. They really respond to consistent voices over and over again. This is a definition of being trustworthy, is showing up over and over again, and credible voice. One team I thought did a really good job during COVID was Maria, Tedros, and Mike. They showed up every dang week on a panel to just answer questions and tell them the current state of affairs. And what I loved even more is even if they didn't have an update, they still showed up that week to say that we're still paying attention, we're still here. They gave voices, they gave warm bodies to a huge institution, which I think it helped me. I started like noticing Maria changing her curler size, right? Like you start just getting to know them, like you feel like you know them, and that helps with trust. Now, I know I've been saying a lot about talking, communicating. One way we can do this, because believe me, I know our capacity in public health is really strained right now. We can't necessarily do all of this like I can protect my whole day doing, is how we show data too, right? We are in the moment of a billion dashboards. And one big mistake I think that I've started to find or have noticed is that with dashboards, people typically just throw up all of their data on a dashboard, just like show how much data they have, how smart they are, like how much access they have. The problem is that doesn't help anyone. And so we need to be a whole lot better at data storytelling. Part of that is being really thoughtful in leading to deeper understandings. One thing I did over at CDC was this was their measles page, like last year actually. And I don't know what any of this means, right? It didn't tell me a story. I didn't know what to do with it. And so over time, we try to create something that was more useful, more in a larger context, and really try to speak to people through this website. Because if we weren't there, we still want a message to come out and to come across. Data can also and needs to lead to action. This was another project I did over at CDC where they had a ton of data around heat risk. This team has actually just got fired, but they had a ton of data around heat risk, heat health risk. And they wanted to put it on this left-hand thing of the United States of America showing where heat risk changed over time. And it was actually kind of cool. It's very hyper-local data. But I really challenge them to think it next. Like, if you want a mom who has a kid with asthma who's doing soccer practice this weekend, what do you want her to do with this, right? Like, as a mom, and be like, oh, it's red, okay. Like, I don't know what to do with that. And so we took it one more step to integrate hyperlocal, so you can enter your zip code, and what pops up is what we guide them to do, is our recommendations, that it is a heat risk. This is what you should be doing, or this is at least what I'm thinking about doing as a parent in this space. And really lead them to action, this data to action aspect. So show up where they are, right? I said show up them on social media, but heat risk is a great idea of what we were trying to think before they were dodged around how we can show up where people are. Weather right now, weather apps are the most trusted source of information in the United States. And so we are trying to think through, and we're partnering with a really big company in the United States on how you integrate health information into the weather app, right? It's already where people are going. It's already natural for them. And we can then be really innovative and see how we can fit into that narrative and to build more of a public health sort of response. Another example is showing up where they're at is my newsletter. It is a strength and honestly an incredible honor to land in someone's inbox right next to their bank statements, right? It's very personal. They're already going to their inboxes, and I happen to be then providing health information to them. Same with social media, right? We're already scrolling through Instagram or TikTok or whatever. Like, it'd be awesome if we can then just insert and say, hey, this is a public health message that while you're doom scrolling, you can think about. So we need to show up and let people see that we're showing up too. One of the other things I've been thinking about on the how is, again, that this idea that the historical practices of communication are just outdated. We in public health, and I would say in a lot of institutions, rely on this trickle-down effect, that CDC says it, and then eventually it'll just trickle down into every single household, and that is just not how information flows right now. It is not reaching all the households for a number of reasons, and this is based on a deficit model, right? That people just need more facts, more facts, more facts. What I think we need to do is think very differently in this model. And this is how I've been thinking about it with my newsletter, is that sure, ivory towers are going to say messages. Some people are going to meet them. But what I'm very focused on with my newsletter is equipping trusted messengers, physicians, pastors, education boards, community leadership, policymakers with this information that then they can translate and send out to their networks. One great example is the chief finance officer of Charles Schwab emailed me the other day asking if I could help him translate a little more about the words I was saying about routine childhood vaccines, because he wanted to include a blurb on top of his stock market report he sent to 100,000 employees. So, like, think through how there are trusted messengers in our community, and they can be incredible partners in getting health information out there that maybe traditionally we didn't think about. The other thing I really think about at YLE is my newsletter is not only equipping trusted messengers, but creating a feedback loop. We have to listen to the concerns that are happening, that the questions people are having. 90% of the content on my newsletter is actually not what I think as an epidemiologist is fascinating. And when I write about something I think is really interesting, it completely flops because no one cares. They don't care about some random virus doing something weird. So I lean into a lot around this listening, is what is on people's minds and how can I meet them where they're at. And this is a lot of work, but it means reading comment sections. It means having a community manager now on the YLA team that's understanding themes and questions. It's me asking. I asked 2 days ago on all my social networks, Like, what are your questions around seed oils? We got 3,000 questions in. People, and now I have a post going out tomorrow that directly addresses all those questions, right? So really think through how you can create that feedback loop with your topic, with your institution, with your interesting piece of science information. Okay, 2 more parts, and I promise I'm done. The second to last how right now is that we have to be brave. We have to put our necks out there, and that takes a lot of courage. It's very scary for me, and it's actually been very personally, I've gotten in a lot of personal situations that make it really scary too. But and there, there's inherent risk to this professionally, right? I could get that nuance wrong too. And a lot of peers let you know when you got that wrong too. But we cannot be scared right now. Americans deserve to know that their science, our work, is helping them stay healthy. We have to take the leap. What you will find is that 99 out of 100 times that you show up and put your neck out there, people really appreciate it. Even if it's imperfect, even if sometimes it's uncertain, even if it's really uncomfortable for you, people really, they love it, right? Humans are naturally curious, and we need to lean into that. There's 3 things that help me feel brave that may help you feel brave. Is one, and I already talked about this, communicating uncertainty. What do you know? What do you not know? And how are you finding answers? Whenever I write a topic about that, like H5N1, that's rapidly evolving, the reason it makes me feel brave is you'll never be wrong if you're being honest, because you're bringing people along for the ride. Second is hear constructive feedback. This sometimes hurts a lot, but has really helped me become a better communicator. I still in my mind write my posts like I'm writing to my sister. So I send them to my sister and ask for her feedback of like what doesn't make sense. And then I also read notes from comments and feedback I get back from real time as well. The third part of being brave that helps me is support, is being out there, right? Communicating in public or public facing or communicating to policymakers or within your institution is not meant for everyone, and that is totally okay. But what hurts me the most is not death threats or people showing up at my house or sending packages or getting doxxed. It's the 1,000 paper cuts from colleagues that don't understand the need, the value, or the time I'm putting into this. And so if you see someone putting their neck out there and just trying, send them a note. Say, I see you, you're super brave, like go for it. Because we really need to lift up people that are willing to enter the arena, because entering the arena right now is quite scary. Okay, last thing is we have to advocate for an environment to do this. Part of being brave is not accepting the status quo, that we need to change the priorities of institutions, and this requires institutional support. All of this takes time and effort and resources. It's time away from your lab or applying for a grant. So, but institutions really need to start supporting it. One thing I really remember is I was going up for tenure during the pandemic, and my newsletter at the time, each post was reaching about 1 million people. And on my CV, the only place that this work could go in was one bullet under community service. And so we really need to push institutions to think about impact differently, to think about how we can support people doing this differently, how we can integrate it into grants, right? All of our grants should have a communication or dissemination or stakeholder engagement piece. We really need to recognize that communication and engagement is a scholarly activity. It's a scholarly contribution. And so this comes from your guys' advocacy from within. Right now is a really unique opportunity to engage in this sort of advocacy within institutions, because institutions are really scared right now, and they really need to, I hope they're getting the message that they need to evolve. And this may be a solution that they may be looking for or very interested in at this moment. Okay, So to become visible, we have to transform our work, inspire action, challenge ourselves, as well as change the systems in which we reside. Right now, we have to have compelling stories and useful tools and communicate in ways that resonate with people. We have to bring them along for the ride, make truth memorable, and inspire action. So to summarize, really think about being purposeful right now and how we all communicate. I know this is a lot of words, and this is actually a lot for me to ask someone to do. But even if you just do one of these things on this slide, right now with your work or with your institution, or with even just your way of thinking differently and the partnerships that you forge, it's a step in the right direction. And if we all just take one step forward and one step forward, we'll eventually be there. But it means that we all have to do our part in this. So I want to leave you with this, that I view this information landscape where we're at right now as a really dark storm. It actually reminds me a lot about COVID, about weathering a dark storm too. But I don't think it's necessarily all doom and gloom either. There's many, many, many things we can do. We're actually all trusted messengers too, right? And figuring out how to engage with the public. Being trustworthy is demonstrating over and over and over that you are. It's a set of acts, right? It's clarifying uncertainty, revealing authenticity, vulnerability. It's being human. It's owning up to mistakes, and it's consistently behaving in certain ways. And there's a lot we can all do for this to make sure we're not invisible. We just need to make that first step and do all our own part. So thank you. And I think we can open for questions. Yeah.
Thank you so much. Can everyone hear me? No. All right, I'm just gonna
Yeah,
share
just-
with you. Thanks. Okay, thank you so much again. So many things to take away from that presentation, but I really appreciate all the concrete examples and strategies and the messages of hope that you left us with as well. We do have about 30 minutes for questions, so we will open it up. Avery in the back can run the mic to anyone in person that has questions. And anyone online, if you have questions, please continue to put them in the chat. We have Megan monitoring those questions, and we will make sure to integrate those kind of throughout this discussion part. As people either get their courage to answer their questions or think through all that they want to ask, I'm happy to start with one. And I must say that all the questions I wrote down while you were talking were then answered. So you are very good at thinking through questions and concerns and confusion. But that 80% of misinformation that you said is made up of those concerns, questions, and confusion really had me thinking. And you talked a lot about how you kind of go to where people are to understand that. But we also live in a very polarized society. So I'm curious if you can talk a little bit about how you go to the audiences that might not be seeking your information out to get those questions, concerns, and confusions.
Yeah, this is like the $1 billion question right now, right? Is like, how do we break echo chambers and how do we send out olive branches? There's a few things I do. I'll be honest, I'm not sure if it works. I mean, I need like a network analysis, but the first thing I do is I read things that boil my blood. I listen to Joe Rogan. I subscribe to the Free Press. I I have conversations with people I know are MAGA, honestly. And I really, truly try to understand where they're coming from. Because I think that once we can understand their values, what resonates with them, we can then be helpful to them too, and they'll see that. One thing that, and so I think it's, yeah, reaching out to groups that you don't necessarily agree with. The other thing I do on a very regular basis, especially right now, is a lot of people are reaching out to me through my newsletter saying that I am integrating way too much liberal bias into my posts. And when they do that, I actually genuinely curious of what they're hearing as my bias and what mistake I'm making, because that is not my goal. And so I emailed them directly back, and I'm like, can you like walk me through this? Like, what words triggered you? Why are you, what made you pissed off about this post? And we get into a conversation about it, and they really help me. So it's that constructive feedback part of it too, that I'm not afraid of. And in fact, I see it as a huge value that they're willing to respond to me and give me feedback, honestly, in a very chaotic world. And so I try to take that very seriously. And then I ask them to follow up if they see another one, and just keep providing that sort of feedback. So that's what I do. I think we can all do some of that right now too.
Hi. Okay. I'm Amy Bernard, huge fan. I've been subscribing, a paid subscriber since the very beginning, and I listened to you on America Dissected, so huge fan. Big question I have for you, as I'm an immunologist, science communicator, and educator. I talk to vaccine hesitant people all the time. I do a lot of writing with unbiased science, and a big problem is that people will say, well, we now have someone in charge of Health and Human Services who is telling us vitamin A is preventative for measles, or Suzanne Humphries was on Joe Rogan, and then just all kinds of mis and disinformation, and that person has an MD. And I struggle with how do you talk to people about when someone has the degree and is spewing misinformation? It's different when it's someone who doesn't necessarily have like an MD or an MPH or a PhD, but it's a little bit more challenging when that person has the credentials.
Yeah, white coat on white coat. Yeah, I mean, this is a huge problem right now, and it was a huge problem during COVID too. We saw with like ivermectin and stuff. I think there's different approaches depending on where you are and you sit in the atmosphere. I mean, I think that there's definitely systematic things that need to be explored. But I think that how I approach it is I realize and I recognize 80% of Republicans really trust Kennedy with their health. And so if I come to them saying Kennedy's an idiot or something like that, I've totally stopped them in their tracks. One thing that does resonate is when I wrote about vitamin A and measles, for example, was I wrote it and tried in a very calm and steady voice, but also then reserved a section on why people are attracted to vitamin A versus MMR vaccine. And it comes down to a lot of values. It comes down to nature fallacy. It comes down to a lot of reasons. And I think that that post was actually shared very widely in West Texas because one, I tried to listen to why they were attracted to vitamin A and then try to give my case too. And I think that resonates. I think there's also a difference between right now, public health world is having a really hard time reconciling the things they disagree with Kennedy on with the things that they agree on. There's a lot of things I agree with Kennedy on. School lunches for kids, I'm all on board. And so I think it's also that we have to defend and say when we agree with something too. And if we can do that patiently and over time, then maybe people will be willing to have conversations on things that we don't agree on either. But I try to think of it very much in a more of a patient aspect than trying to take Kennedy down, for example. People have very different approaches to that, but that's what's worked for me so far. Yeah. Oh, online.
Okay, so we have an online question that says, thank you for this wonderful talk. How do you navigate being honest about uncertainty without making people realize that some uncertainty is normal and that you shouldn't discard the message because there is inevitably uncertainty around it?
This is something that makes scientists really uncomfortable. And honestly, it made me really uncomfortable at first because you're supposed to be seen at, we think we're supposed to be seen as the expert on everything, right? We know everything. And that's why I got my MD or that's why I got my PhD. But that's just not the truth, guys. Like we do not know everything. And so one concern I continually hear, and this is what the online commenter set, I think is getting at, is that if we start talking about uncertainty, are they going to trust us less, right? And what I've actually found in the field, me doing this on the front line, is it's actually the opposite. And people then understand where your knowledge ends and then how you're thinking about things that are evolving. And when you can do that, it actually builds a lot of trust. It builds a ton of trust. Sure, people are going to be like, you know, you're supposed to know everything, whatever, but that's not who you're trying to build. No, that's not how I'm trying to build an audience with. And so I actually think it's better if we talk about uncertainty. It's one thing that got us in a ton of trouble during the pandemic. And we really need to learn from that too. Yeah, good question.
So I was curious, you spoke about how it's really hard to tell stories, and that's like the way that you connect really well with people. What are some tips or tricks, or can you speak a little more to like how to make that a skill for us?
Yeah, you just have to try. So I actually tried this when I wrote a post a month or two ago when the administration decided to part ways with WHO. And I started the post talking about my work at the WHO. And actually what surprised me and what actually was really effed up about WHO that I learned about, right? And where my frustrations were. And then I go into what WHO is and that sort of stuff. And so I try to bring more of my personal experiences to it, of like why I care about this topic this much. There's sometimes I'm talking about topics I just don't care about, like seed oils. Like I don't think about that. So like I'm not going to put a story in there. But all of us in public health have experience. I mean, that's the cool thing about our degree is we get experience in every, like very different areas, and also personal experience, right? I'm a mom of two little ones that drive me crazy, right? So like there's that you can bring forward too. And so I always try to anchor it in why do I care about this as a human being and bring that forward. Another great example is someone I work with. She had an anti-vax mom. She didn't get her vaccines until she was in college. And so she really leans on that to like with empathy to be like, I've been there. I get it. I get where these concerns are. And then she goes into her thing. So that's at least how I've tried. I'd probably take like a storytelling course, honestly, or something. Craig Spencer, he's over at Brown, is amazing storyteller with public health things. But I think that it just takes practice and getting really uncomfortable. It makes me super uncomfortable, but just trying. Yeah.
Thank you. Is that on? All right. Hi, Sarah Lampy. One of the things you said that actually like really gets under my skin a little bit is the million paper cuts and the like over criticism that we as public health professionals have of each other and how we communicate messages and the expectation of perfection that we set into ourselves. What advice, what do you have that can help us as a field kind of lean more into the expectation of holding each other up to promote good communication styles and not expect perfection in how we do this?
It's a culture change that needs to shift. And it's not just, you know, in academia or our colleagues, this is a huge problem at CDC too, is that there's a lack of respect or understanding, or I don't know what it is, that people are doing things differently and that's needed. There's a few things I try to do at CDC to implement cultural change. Is one, it was more of the carrot and stick approach, right? Like start elevating people that are doing really cool stuff. Like Mandy Cohen gave out an award that, you know, around scientific communication and really showed that it needed to be a priority. So it comes also from like leadership prioritization too. And that's where I think advocacy from within works. And I keep thinking the other thing we did was tiger teams. So kind of go in and like force people to like work with each other and like do things differently and then elevate that work to start seeding change. One thing I know about that I read about from Adam Grant actually in change management is that you only need to change about 20% of the perspectives and then it'll go viral for the rest of the organization. And so what I was trying to really think through is like, who are those 20% that like kind of get it, that we can like start pushing, and then eventually that culture hopefully would change. But I agree, it's literally what hurts me the most. Yeah, I don't know how best to do it. Do you have any ideas? I would love to hear. Yeah, I mean, so I think, like I said, it comes from leadership priorities, top down. It comes from bottom up, and then it comes from time. I think we just need time to move in a different direction. And people are being forced to think differently right now too, which could be an opportunity.
Their online question.
Yeah.
All right, so this says, you mentioned that we didn't bring people along on the scientific journey during the pandemic. Are there 2 to 3 examples of some of the worst, well-intentioned messages that undermine the pandemic response as an example of what not to do?
Yeah. Yeah. Okay. First, is masks. I mean, I'm still incredibly frustrated and angry around the arc of mask use in the United States. That first, we are told you don't need masks. Then we are told you need cloth masks. And then we're told you need, N95s. And then we're told that if you're vaccinated, you don't need a mask. And then you're told, oh shit, everyone needs a mask again. And like, there was we did not have the scientific knowledge at the beginning to know if masks worked or not. We needed to say that. We also need to be incredibly transparent around policy decision-making. That sometimes a policy is made not because of science, but because of other reasons, like PPE not being available to healthcare workers in the beginning. Just tell people that, right? Just tell people that we need to protect the nurses and physicians in hospitals right now. That is why we are not recommending masks. That was never told. And I do not blame people. I certainly understand where that entire arc of mask wearing was completely confusing. And I think that if we started from the beginning saying, this is what we know about masks, this is what we don't know about masks, and this is how we're finding out, would be a whole lot easier for people to pivot along the way. And so, God, masks is a great one. Another one, which is makes people, it's hard to hear this constructive feedback, but the lab leak at the beginning. And I actually fell victim to this in the beginning. I write about that in my newsletter sometimes, that the reason why I dismissed the lab leak in like January and February of 2020 was not because I was thinking about the science or the evidence. It was because it was the messenger. It was Trump and I didn't trust him. And we didn't know. We still don't know if it came from a lab or not. And then what was created was this war between lab leak and natural spillover, when really everyone is just on a spectrum, right? I'm like 80, 90, 80, 70, 80% lab, or 70, 80% natural spillover, but I get where it's confusing. We don't have that answer. And so I would have loved for that messaging to do that too. What we know, what we don't know, how we're finding answers. Sometimes though, the reality is it's really hard to say those things in a political environment. And I actually experienced this a lot in Texas when I was helping with the response. I wasn't allowed to say the word mask on TV. I literally was not allowed to say the word mask. Now I'm not allowed to say the word COVID vaccine in the state of Texas, right? So like, I think figuring out how to get around those challenges are also really hard, especially in a moment of an emergency. But we really need to strive in public health to be able to do that, because that's where you build trust. So I guess those two things come top to mind. Yeah.
Thank you so much. This was all wonderful. My name is Ariella. I work for a public health organization called Vital Strategies. most of our work at the organization, but also my work personally, is around prevention of non-communicable diseases, or NCDs. I've really appreciated your reflections on communication in emergent situations and crises, dealing with topics that are prescient because of policy change. I think we still struggle when it comes to trying to communicate to people about, for example, the harms of chronic exposure to PM 2.5. Like, how do you crack that nut around prevention in its, I would say, sort of most essential form? And maybe what have you learned from emergent communication that can be then applied to prevention communication?
Yeah, I agree with you that making the invisible visible with things that aren't necessarily top of mind is really challenging. I think a really interesting shift right now is that a lot of people are very curious around chronic sort of diseases right now. And understanding, I think that is a huge opportunity for us to start communicating about it. One thing I think we need a whole lot more better tools to help us do is to talk about that prevention a lot, like we talk about ROI, return on investment, right? Is you invest $1 for this, you get this many dollars out of it. We could do that with lives saved, for example, or quality of life, or like we need metrics to talk about this sort of stuff, right? To make it tangible, make people feel it. Part of this is also being responsive to the needs on the ground and figuring out where the conversation currently is and how what we care about can enter into that conversation. So for example, if we're talking about, here's a great example, ticks, right? Everyone's really curious about ticks right now because they're starting to increase and we have green lush and sort of stuff. It's a great time to start talking about climate change without talking about climate change. Is that we're getting more ticks, our season's getting longer because we're seeing more rise in temperatures, like force it into the conversation, what the conversation is happening. Because what I will tell you that doesn't work is coming out of left field and then all of a sudden talking about wildfires when there's not a single wildfire out there, right? Like, so we have to be really responsive to the conversations that are happening at that time to show people why it impacts them today, not in 9 months. It's hard for them to care about it in 10 years, but like today, why does it matter? And I think that when we can do that, it's the best. Another example is wildfires in Los Angeles. We just had a really big wildfire in Los Angeles. And Joseph Allen, who's really a lead researcher on filtration and ventilation, was right there saying why ventilation and filtration help, talking about PM particle sizes. I mean, he was doing all sort of things because he recognized that he had knowledge to insert into that conversation, even if he wasn't invited. And so that's at least how I think about it in the moment. Yeah.
Thank you. So I'm Amy Betts. I'm a faculty member here and a founding director of the Firearm Injury Prevention Initiative. So my question for you is, recognizing that many of us in this room are either affiliated with the university or affiliated with a state entity and have identities that may be very closely linked to our organizations. And I'm curious what you would give as advice for people who want to start doing more of this, but are also trying to be sort of find their own voice and not piss off their institution, for example, if they're working on a sensitive topic.
Yeah, I actually experienced this head on when I was faculty doing my newsletter stuff. What I have found is that sometimes you have to make them completely separate. That anytime I was talking about what your local epidemiologist, I wasn't using my university computer. It wasn't the name that flashed on the TV screen when I was on news. I mean, it was in my personal capacity to do something like that. I hope that institutions are seeing that their employees are part of the community and can really help be a partner in what's needed at this moment. I think the other thing is that it comes back to something I was talking about earlier, but we have to stop fighting for institutions. We have to start fighting for families, for kids, for people to live healthy lives and thrive. And that involves a script switch. And in fact, Harvard is doing this brilliantly right now. I want to know who they're consulting because they're flipping the script. Their homepage now tells them what their research does for Americans. That wasn't on their website before. And so figuring out how to get on the offense in this moment, I think is really important. And no one will disagree with you if well, maybe people, okay. People can feel it more when you're fighting for other people rather than institutions in this moment. And so, yeah, it's really challenging to do this within an institution. It's a reason I'm not in an institution right now, just to be frank, clear, because I didn't feel like I could do things with an institution. But we have to figure it out, right? All of us in pro science are in institutions, and that is hurting us right now, right? And so we need to figure out how to not necessarily remove, but how to flip the script in this moment is going to be part of that secret sauce.
Another online question.
Yeah.
It says, thank you. This was awesome. My question is around approaching the moral high ground type of narrative. Any tips on breaking this barrier when folks, scientists, or the general public see their views as inherently for the common good, empathetic, etc.?
Yeah, I mean, I would push back and saying it's not working. Like, people do not trust in expertise right now. Even the definition of expertise is different. There's a huge report coming out tomorrow. Don't know if I'm allowed to say it, but it's coming out tomorrow saying that influence, it's not trust that is declining, it's influence that is changing. And the reason influence is changing is because experts, ivory towers, are so disconnected from the main battlefield of sediment right now that no one trusts them, and they shouldn't trust them. And so I 100%, I try to approach my writing not from a moral high ground, but like, you know what, this is a really good question. Like, let's dissect this a little, and here's some thoughts. So it comes from listening. It comes from adapting and leading them to know what topic we want to talk about. And it's us adjusting to the environment, which is needed and is not happening.
We have time for one more question, and I have seen your hand a couple times back here.
Thanks. This is kind of a pivot, but I was wondering if you could talk about the White House stuff. Like, how did you end up there? What did that look like? What do you do as like someone that close to all sorts of interesting things?
I don't know how I ended up there. Well, so my newsletter became really big, and people that have a lot of power started following it. And I told the group earlier this morning, I have a really strict rule in my house and with my team is that you can't complain unless you have a solution. And so Rochelle Walensky actually called me on my cell one day, and I thought it was a prank, honestly. And I was like, how did you get my cell phone? And she asked me to come to CDC to help fix scientific communication. And so I did. I'll be honest, it took me like a year to actually understand what the F was going on within CDC. It's such a huge organization with really deep cultural challenges. And then Mandy Cohen then asked me to stay on when she became director too. And then, yeah, with White House, there was a COVID czar there that I worked very closely with. And particularly within the COVID response team was an individual, Stephanie Friedhoff, who's over at Brown, who thinks about information diffusion a lot like I do. And so really thinking strategically and carefully around that. But yeah, it was wild. I mean, I still don't, I don't know. I still don't get how I got there, but it's an incredible honor. And I think You know, when I tell you guys we need change from institutions, it's all the way from nonprofits all the way up to the White House. I mean, CDC needs a lot of help, needs a lot of help. And right now, even with all of the dismantling of everything, with a lot of traumatic things that are happening, a lot of my friends losing jobs, I still see this eventually as being an opportunity to build something better because the systems weren't also working before either. And so, yeah, we'll see where it goes, but I'm not at the White House anymore. So we're here. But thanks. Thanks guys for your questions. This is fun.
I do have one more to
Okay.
wrap us up. And I think it piggybacks a little bit off of Sarah's question earlier. Public health is a really broad field. And I think you also alluded it to in one of your answers about how, you know, ticks, you can talk about climate change. So how do we as public health practitioners across a range of health topics work together to communicate towards common goals?
You ask people. I mean, when we left the emergency of COVID, and I was like, okay, I need to figure out how to show people that public health goes beyond a pandemic. The first thing I did was like, okay, I need a bench of people. Like it's this multidisciplinary approach, right? It's like one epidemiologist in one little corner of the world does not know everything. And so I started building a Rolodex. So I called immunologists. I called Joseph Allen, who talks about filtration and ventilation all the time. I talked to misinformation people. I now have a nutritionist on my team. So like, I truly believe in the power of a multidisciplinary approach. We just need to figure out partnerships, whether they're formal or even informal, on like how we start talking about this stuff and when we start talking about it. And I think that's the only way because we don't know everything unless ChatGPT gets better, but I don't think it will. So we'll see. Yeah.
Thank you so much for that. I think we can, I think I speak for a lot of us where we look forward to seeing you in our inbox
Yeah.
very soon.
Seed oils.
Yes, before we wrap up, thank you again, everyone, for joining and everyone online. And thank you to the Office of Gun Violence Prevention, as well as the Injury and Violence Prevention Center for helping co-host this. And thank you, Dr.
Yeah.
Jetelina.
Thank you.